Hello all, this is Priya. Today we are going to talk about listening and some tips. In listening, you will have 42 questions. So you have to answer 42 questions. In those 42 questions, that will be divided into three parts. Part A, B and C. In part A, it will be subdivided into two extracts. Extract 1 and 2. So, in part A, each extract will have 12 questions. So, before going to answer these questions and you're going to listen to the audio, you will be given 30 seconds to review the extract which they have given. So, what you will see in this extract? So, you will see a conversation between a doctor and a patient, or some health professional and a patient. So it will be like asking some questions and health related questions related to the patients and their health conditions. So you will see some blanks. For example, if the patient is telling some about some symptoms, signs and symptoms that they have, there will be some 3 to 4 symptoms, but you will see some blanks in that 3 to 4 symptoms. For example, they will give 2 symptoms and 2 symptoms will be like blank. So you have to answer what the patient is telling to the doctor. Same like that, you will have a patient signs and symptoms, diagnosis and past medical history and something like that. So it will be given and some information will be given and some will not be there. So you have to listen what the patient is talking and what the patient is telling to the doctor. So you have to listen properly and you have to answer the question in listening part A. And one more thing is what you're going to do in that 30 seconds before listening to the audio. So you have to see where is the blanks. So if in case of there is a blank in investigations, so you have to see how many blanks and you have to be more careful while listening to the investigation part, what the doctor is talking to the patient or the patient is talking to the doctor. So in that case you have to be make a little note and you can just make it in your mind, or you can just even write in the question paper that you can rub off after finishing the extracts. And what I would suggest, you can actually you can use pen or pencil in your exam, but what I can suggest is you can use the pencil so that you can rub off anything. And if you go to part B, you will have 6 questions where each you will get 15 seconds to review each questions before getting to the listening audio. So before starting to the audio, so you will be given 15 seconds. So in that 15 seconds you have to read the questions and options. So what you can have in mind is you have to understand the question, what they are talking about, and what is the possible answers you can see in the listening part. So after listening to the audio, obviously you'll get to know what will be the answer. But try to listen to the audio as much as possible, because once you will not be you will not be able to listen to the audio again and again. It will be played at only once. So it is more important to listen to the move on to the audio as much as possible. So that's how the part B will be. So it will have 6 questions. When you see part C, you will have two extracts, which is like part as like extract 1 and extract 2 in the part A. So this is slightly similar like part B. The only thing is you will have longer extract. So in case of part B, you will be given a very short brief listening audio. But in case of part C, it will be like a interview or a seminar. So this is the two most important part C extracts that you will have. So it will be either like it will be a interview. So one of the interviewer will ask one of the one of the person about some research or anything, so they will be answering. So the questions will be like, you can expect that the questions will not be like interchanged, it will be in a order. So when you are listening something, that will be in the nearly in the first or second questions. So if you are going to reach the last question, so that will be the probably that will be the end of the audio. So it will be in a order. So that will be helpful for you to find out where you are. And don't be braked and stuck in one question, and don't try to move before you listening something. So that will make you to miss so many questions. And in that part C, as I told you, you will be given a longer extract and you will listen a long audio, and you will be given 6 questions. So you have to answer as you listen, because as I told you, you will not be you will not given a second chance to listen or anything. And finally, when you finish the listening, you will be given 2 minutes to check all your answers. So you can ask me that while listening, it is writing while listening is a really hard one. So how can you make it bit more easier? So we have a lot of abbreviations. So for example, if you are listening some investigations as ultrasonogram, so you can just write as USS, so that we know that it is ultrasonogram. And some investigations like computerized topography, so you need not to write computerized topography while you are listening, so you can just write it as CT. And if you while checking your answer, you can just change it as computerized topography, as like BP in blood pressure, hypertension as HTN, and some abbreviations that you can also make. So but the thing is, if you are leaving as it is, if it is not an authorized abbreviation, you will not be scored. For example, if CT is a standard abbreviation, you can leave it as CT as well. But if the thing is, you are making some abbreviations just to make it write it faster, but you're leaving it as it is, while correcting, they won't mark that abbreviation which is not the standard one. So you have to remember that, and get familiarized with all other professions as well. But while we are studying nursing itself, we'll be like given knowledge regarding pharmacology and some other nutrition things and everything. But the thing is, you have to review everything once, just to make sure that you're up to date with that, because sometimes it will be like rusty and we'll forget things. So just to make you in update things. Now I will tell about the time durations of this listening. Obviously, you will be given 45 minutes. It will take 45 minutes for the whole listening thing. But personally, if you ask me, I would say you don't want to bother about the time and durations in case of listening, as you will go on to the audio. You don't want to look much about the time duration, because you don't have anything to do with the time here. It's all about the audio and listening that you are listening to. So you don't want to worry about that. So that's about listening. And I'll finish my video today. இன்னைக்கு வீடியோ நான் முடிச்சுக்கிறேன். And இன்னும் கூட உங்களுக்கு ஈஸியாக கொஞ்சம் கூட டிப்ஸ், just to make sure that you're getting much more about the listening thing, I would like to give you a video regarding the listening and some tips and how they will score you, that in a description. So you can just go and look at the link that I've given. I think you have gone through the link which I've given you previous video. If not, it's okay, no problem. You can just go and look at this listening, because I'm going to give you about much more details about each modules in my upcoming videos. So hopefully நாளைக்கு பார்க்கலாம். எனக்கு நைட் டியூட்டி இருக்குது. I'm going to get ready. So see you later. Bye. Please do subscribe my channel. Please share and share to your friends. Like பண்ணுங்க, share பண்ணுங்க and comment பண்ணுங்க. Bye.